Hi there, I'm Dr. Mariati. Today I will share with you another important component of removable appliance, which is Biteplane. This lecture will highlight several learning or outcomes for this topic. The first one is the definition of biplane. You are required to define the biplanes. Identify the types of biplanes. Explain the principal use and mechanism of biplanes. List the indication and contraindication of biplanes, illustrate the design of biplanes, and discuss the construction of biplanes. Let's go through what is the definition of biplanes. Biplanes are usually incorporated into the design of a removable appliance as an extension or modification of the acrylic base plate. The base plate is constructed from cold cure polymethyl methacrylate. There are two types of biplanes. The first one is anterior biplanes and the second one is posterior biplanes. These biplanes is actually formed by acrylic base that can be thickened or modified anteriorly or posteriorly to form anterior or posterior biplanes. Let's go to the first one, anterior biplanes. Anterior biplane is usually known as flat anterior biplane. It is thickened platform on the acrylic that is built parallel to the upper incisors. It is similarly as highlighted in the diagram. What are the principal use of anterior biplane? Anterior biplane are used for correction of deep overbite. The mechanism behind the correction of a deep overbite is through the alteration eruption of posterior teeth, which allow the molar to extrude with minimal lower incisor intrusion, especially in growing patients. There are some few mechanisms which highlight in anterior biplane. The first one is anterior biplane holds the lower incisors and this occlude the posterior teeth. This will allow the eruption of posterior teeth and produce relative lower incisor intrusion. This is similarly as what highlighted in this diagram. This also will have some effect in the curve of speed correction where the curve of speed that it presents with very minimal curve of speed. We also provided videos for you to go through and highlight a little bit more what is the anterior biplane. You can watch that afterwards. Next is anterior biplane's mechanism works behind it is actually through which allow the mandible to rotate downward and backward. As a result, there will be increase in vertical height in the patient who especially presented with reduced vertical proportion. There are several indications that can be highlighted which kind of patient would benefit with the use of anterior biplane. Patient who presented with a deep bite, as highlighted in this photograph, with the vertical overlapping between the upper and lower front teeth are quite visible and quite prominent. Therefore, they will benefit with the extrusion and eruption of posterior teeth. The patient who has cuspal interference also will be benefits with the fabrication of anterior biplane. Also, those patients who has pain associated with temporomandibular joint disturbance. Anterior biplane also can be useful as a diagnostic plane for joint pain or temporomandibular joint pain. Patient presented with reduced lower facial height and low frontomandibular plane angle definitely will benefit with the fabrication of anterior biplane because it will allow the increased vertical proportion and may affect and improve the profile of the patient. Anterior biplane is contraindicated in patients which diagnosed with high frontomandibular plane angle. Also, patient may present with increased lower facial height. where the patient presents with severe proclination of the lower incisors, also contraindicated for the use of anterior biplane. Another reason that are not suitable for anterior biplane use is patient who has skeletal deep bite, where the treatment would be best to go for the orthodontic surgery to correct the problem. Another types of anterior biplane known as inclined anterior biplanes. It is a modification to the anterior biplane, where this type of biplane is actually has been fabricated with a plane at least 8 millimeter deep at the inclination of downwards and forwards at the angle of 60 to 70 degree to occlusal plane. I have provided to you some of the videos with the fabrication of inclined anterior biplane. The principal use of inclined anterior biplane is for the purpose of reinforced anchorage. It is also very useful to procline the lower incisors in addition to the correction of deep overbite. Inclined anterior biplane will engage the lower incisors upon mouth closing and repositioning or guide the mandible in a forward position. It is very useful in the transition period of functional appliance to fixed appliances phases. Inclined anterior biplane has given several advantages. It allows the patient to have inclined anterior biplane in conjunction with fixed appliances. It allows also the fixed appliances to be placed without any interference. Inclined anterior biplane will allow closure of the lateral open bites that has been produced due to the block that is present on the functional appliance. Inclined anterior biplane also known to be time efficient and is also useful to ensure that the effect of a class 2 can be optimized. However, there are also several disadvantages of inclined anterior biplanes. The first one is when patient has inclined anterior biplane, it would resulting in the interference or it act like a retention appliance when patient has fixed appliances. Therefore, several adjustments are required to ensure the minimal tooth movement can occur during fixed appliances phase. Another reason that anterior biplane may result into is it may result in the proclination of the lower labial segment. This careful attention has to be paid when the clinician have issued inclined anterior biplane to the patient. Inclined anterior biplane will result in the insufficient depth, which allow the relapse to occur, especially increase in overjet. Another thing that we may have seen is there will be a differential eruption of the second molar, which allow the formation of anterior biplane, especially in patients who diagnosed with high frontomandibular plane angle. These are the design of anterior biplane. Highlighted on the left-hand side is the normal anterior biplane, and the lower right-hand side is inclined anterior biplane. There are several important steps that you are required to understand in the construction of anterior biplanes. The first one, the patient cast should be preferably articulated to assess the amount of disocclusion present between the posterior teeth. Anterior biplane should be flat, horizontal transversely and anteroposteriorly parallel to occlusal plane, with posterior teeth are disocclude by 2 to 3 millimeters, as what highlighted in the arrow in pink, where the posterior teeth highlighted in the diagram has been separated by 2 to 3 millimeters. Next step is the biplanes covers the palatal region of the upper anterior teeth extending from canine to canine. The occlusal load should be spread over all 6 anterior teeth. This is very important as you fabricate the anterior biplane. If there is a presence of irregular incisor position, it is necessary to adjust the anterior biplane to contact at least 3 incisors. You also are welcome to look through the video as provided. Let's go through some of the adjustment of anterior biplane for the purpose of overbite reduction and overjet reduction. For overbite reduction, you are required to build up and level the anterior biplane with the addition of cold cure acrylic. Therefore, it will increase the separation between the posterior teeth and will allow further eruption of their posterior teeth, therefore may facilitate the reduction of overbite. For the correction of overjet, you are required to form a mark with a wax pencil on the biplane. The acrylic will be trimmed vertical to the biplane. The acrylic is cut back undermined sufficiently to clear the palatal surfaces of the incisors and the palatal mucosa. Therefore, this space will be created and it will allow retroclination of upper incisors, therefore facilitate for reduction of overjet. Let's go to the second types of biplane, which is posterior biplanes. Posterior biplane is a thick acrylic which is used to cover or closer surface of the posterior teeth bilaterally to disocclude or prop the bite and relieve cuspal lock. The principal use of posterior biplane is to open the vertical dimension by disoccluding the anterior teeth. It is also efficient for the correction of buccal or anterior crossbite by preventing interference of the opposing teeth. Another reason to use posterior biplane is it will prevent the eruption of posterior teeth and posterior segment by controlling the development of open bite. Posterior biplane also will eliminate lateral and anterior displacement of the mandible. Therefore, it will allow the mandible to adopt at a centric position. Posterior biplanes has some indication for its use. The first one is anterior crossbite, where the position of upper anterior teeth position lingual to the lower anterior teeth, while the posterior crossbite occur in the form of buccal crossbite or lingual crossbite, which known as scissors bite, where looking at the position of the upper teeth in relation to the lower posterior teeth. There's also posterior biplane indicated when patient presents with minimal open bite or reduced and average open bite. Reverse of a bite occur when there is a total of 4 incisor teeth in crossbite, therefore it will define as reverse overjet. It's also very beneficial to this type of patient to have posterior biplane. Look at the design and construction of posterior biplanes. This design of posterior biplane begins with the acrylic covers on the occlusal surface of the buccal segment of the teeth. The thickness of the acrylic is sufficient to prop the incisors apart and to aid patient tolerance and comfort. The acrylic can be extended only halfway across the buccal segment of the teeth. Another thing, the thickness of the posterior biplane is thinner in the posterior segment than the anterior segment. It should contact the opposing teeth bilaterally. The adjustment of posterior biplane can be done at the time of fitting. We can use articulating paper to ensure even contact on the posterior teeth bilaterally. These are some of the clinical photos which highlights the use of posterior biplane in the clinical setup with the different types of malocclusion that has been highlighted. These are some assessment for you to go through, some of the questions to reflect on the knowledge and understanding regarding biplanes. I hope it will help you. These are some of the references for you to go through and to get more and better understanding related to these topics.